Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, osteoarthritis or degenerative arthritis is a common problem that often affects the hips or the knees, but it can affect other joints as well. And the pain and swelling and stiffness associated with this condition can very much restrict mobility and prohibit many otherwise enjoyable physical activities. Now, the main drug treatment for osteoarthritis are anti-inflammatory drugs, but as pointed out in the review article in the Journal of Medicinal Food in 2016, these drugs can cause serious side effects such as intestinal bleeding and ulceration, as well as increasing the risk of high blood pressure and congestive heart failure. As such, researchers have looked for natural agents that can reduce pain, swelling, and stiffness in osteoarthritic patients that don't have serious side effects. In fact, there are several natural agents that have known anti-inflammatory properties, but in recent years, no less than 12 human clinical studies have strongly demonstrated the profound anti-inflammatory effect of the natural supplement known as curcumin, derived from the spice turmeric, which has been shown to significantly reduce osteoarthritic symptoms and improve the quality of life for these patients. Now, clinical studies show that curcumin supplementation provides the same reduction in pain, swelling, and stiffness as do anti-inflammatory drugs such as ibuprofen and Voltaren. The difference is that curcumin does not cause intestinal irritation, ulceration, or bleeding, nor does it raise blood pressure or increase the risk of congestive heart failure. In fact, the 2019 review of curcumin, published in the journal Nutritionals, highlights the fact that curcumin also improves blood sugar regulation in diabetics and pre-diabetics and helps to lower cholesterol and triglycerides. These, of course, are very good side effects, not to mention curcumin's well-documented anti-cancer properties. But how does curcumin reduce inflammation? Well, experimental studies show that curcumin blocks the activity of what's known as nuclear factor kappa beta in the body, which is a key driver of the inflammatory and osteoarthritic process. Curcumin also blocks the release of many inflammatory cytokines and inhibits key enzymes that initiate the inflammatory process in both osteoarthritis but also in autoimmune diseases that affect the joints such as rheumatoid arthritis. To benefit from curcumin, it's important that the right dosage is used, otherwise it won't be effective. Typically, this means ingesting 1,000 to 1,200 milligrams per day in divided doses, such as 400 milligrams 3 times daily. It's best absorbed with food that contains a little bit of fat. So this is assuming that the curcumin supplement that you use is a 90% grade of curcumin derived from the Indian spice turmeric. So look for that on the label, 90% standardized grade of curcumin. I personally have seen curcumin as well as other natural anti-inflammatory supplements reduce swelling and pain and stiffness in arthritic patients. So if you suffer from arthritis, you may want to consider using curcumin as an adjunct to your treatment after checking first with your doctor. I've included 2 recent references on curcumin in the text below. Thanks for watching, and I'll see you next time.